The phrase "time is brain" highlights the critical importance of acting quickly during a stroke emergency. When a stroke occurs, blood flow to parts of the brain is interrupted, depriving brain cells of oxygen and nutrients. With each passing minute, millions of brain cells can be lost, leading to potentially irreversible damage. Rapid recognition and immediate medical intervention can significantly improve outcomes and reduce the risk of long-term disability. This is why every moment matters. Delays in treatment can mean the difference between a full recovery and lasting impairment. Understanding the urgency behind "time is brain" can help save lives and preserve quality of life. A stroke occurs when the blood supply to part of the brain is suddenly interrupted or reduced, depriving brain tissue of oxygen and nutrients. This disruption can quickly lead to the death of brain cells, resulting in a range of neurological impairments. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes, the most common type, are caused by a blockage in a blood vessel supplying the brain. Hemorrhagic strokes happen when a blood vessel in the brain bursts, leading to bleeding within or around the brain. Both types can cause lasting damage, depending on which area of the brain is affected and how quickly treatment is received. The effects of a stroke can range from mild weakness or numbness to severe paralysis, speech difficulties, or even death. Recognizing the early signs and symptoms of a stroke is crucial for ensuring timely medical intervention. Common indicators include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Other warning signs may involve confusion, difficulty speaking or understanding speech, trouble seeing in one or both eyes, and loss of balance or coordination. If you or someone around you experiences these symptoms, it is essential to seek emergency medical care immediately. Quick action can significantly improve the chances of recovery and reduce the risk of long-term complications. When a stroke patient first arrives at the emergency room, time is of the essence. The medical team quickly initiates triage to determine the severity of the condition and prioritize care. Vital signs are checked, and a brief medical history is gathered, focusing on the onset and nature of symptoms. Rapid neurological assessments help identify the type of stroke and guide immediate interventions. Blood tests and imaging, such as a CT scan, are often ordered to confirm the diagnosis and rule out other causes. Throughout this process, clear communication among the healthcare team ensures that the patient receives prompt and appropriate treatment. Rapid imaging tests, like CT scans, play a crucial role in determining the type of stroke a patient is experiencing. These tests can quickly reveal whether a stroke is caused by a blockage in a blood vessel, known as an ischemic stroke, or by bleeding in the brain, referred to as a hemorrhagic stroke. Accurate identification is essential because the treatments for these two types differ significantly. CT scans are widely available in emergency settings and can be performed within minutes, providing vital information to guide immediate medical decisions. By distinguishing between stroke types, healthcare providers can administer the most appropriate therapies, potentially improving outcomes and reducing the risk of complications. A coordinated response from the medical team is crucial during emergencies. Each member has a specific role, working together seamlessly to ensure the patient receives timely and effective care. Streamlined protocols guide their actions, minimizing confusion and reducing the risk of errors. By following established procedures, the team can quickly assess the situation, prioritize interventions, and communicate clearly. This organized approach not only improves patient outcomes, but also supports the safety and confidence of everyone involved. Ultimately, well-defined protocols are the backbone of efficient and successful medical interventions. Tissue plasminogen activator, or TPA, is a medication used to dissolve blood clots in certain medical emergencies, most notably in cases of acute ischemic stroke. It works by activating the body's natural clot-dissolving system, converting plasminogen into plasmin, which then breaks down the fibrin in clots. This process helps restore blood flow to affected areas of the brain, reducing the risk of long-term damage. However, not everyone is eligible to receive TPA. It must be administered within a narrow time window, typically within 3 to 4.5 hours after stroke symptoms begin. Patients are carefully screened to rule out conditions like recent surgery, bleeding disorders, or high blood pressure, which could increase the risk of serious side effects. Proper evaluation ensures that TPA is given safely and effectively to those who are most likely to benefit. Tissue plasminogen activator, or TPA, is a medication used to dissolve blood clots in patients experiencing certain types of strokes. The administration of TPA is highly time-sensitive, as it is most effective when given within a narrow window, typically within 4.5 hours from the onset of symptoms. Delays in treatment can significantly reduce its benefits and increase the risk of complications. Medical teams must quickly assess the patient, confirm the diagnosis with imaging, and rule out any contraindications before proceeding. Rapid coordination and decision-making are crucial to maximize the chances of recovery and minimize potential harm. Every minute counts, making swift action essential in the management of acute stroke with TPA. Thrombectomy is a medical procedure designed to remove blood clots from blood vessels, most commonly in the brain. It is primarily used in the treatment of certain types of strokes, specifically those caused by a blockage in a large artery. This procedure is typically considered when patients arrive at the hospital within a specific time window after stroke symptoms begin, and when imaging confirms a suitable clot. By physically extracting the clot, thrombectomy can quickly restore blood flow to affected areas of the brain. This rapid intervention has the potential to minimize brain damage, improve recovery outcomes, and reduce long-term disability in eligible patients. Thrombectomy represents a significant advancement in acute stroke care, offering hope to individuals who might otherwise face severe consequences. When a patient arrives in the emergency room with a suspected blood clot, the medical team quickly assesses their condition and orders imaging tests to locate the blockage. If a thrombectomy is needed, the patient is typically given local anesthesia and sometimes mild sedation. A small incision is made, usually in the groin or arm, to access a major blood vessel. Using specialized catheters and imaging guidance, the doctor carefully navigates to the site of the clot. The clot is then captured and removed, restoring blood flow to the affected area. Throughout the procedure, vital signs are closely monitored. Afterward, patients are observed for any complications and may require further treatment or monitoring, depending on their overall health and the location of the clot. When treating a stroke, doctors often consider two main interventions: TPA, a clot-busting medication, and thrombectomy, a procedure to physically remove the clot. TPA can rapidly dissolve clots and restore blood flow, but it carries risks such as bleeding, especially if administered too late. Thrombectomy offers a more direct approach and is particularly effective for large vessel blockages, though it also involves potential complications like vessel injury or infection. Physicians weigh factors such as the type of stroke, time since symptom onset, patient health, and imaging results to determine the safest and most effective treatment. By carefully evaluating these elements, doctors aim to maximize recovery while minimizing potential harm. Effective communication is a cornerstone of care in the emergency room. The ER team takes time to explain procedures clearly to patients and their families, using simple language to ensure understanding. They answer questions patiently and provide updates throughout the treatment process. By addressing concerns and outlining what to expect, the staff helps to ease fears and reduce anxiety. Compassionate communication not only builds trust, but also empowers patients and their loved ones during stressful moments. This approach fosters a supportive environment, making a challenging experience more manageable for everyone involved. After emergency treatment for a stroke, Patients are closely monitored in a hospital setting. Medical teams track vital signs, neurological status, and watch for any complications, such as swelling in the brain or changes in breathing. Recovery often begins with gentle rehabilitation, including physical, occupational, or speech therapy, depending on the effects of the stroke. Doctors work to identify the underlying cause and may adjust medications or recommend lifestyle changes to prevent another stroke. Family members are often involved in care planning and support. The next steps focus on regaining independence, managing risk factors, and preparing for a safe transition home or to a rehabilitation facility. Recognizing the signs of a stroke and seeking immediate medical attention can make a critical difference in recovery outcomes. Time is of the essence, as prompt treatment can help minimize brain damage and improve the chances of a full recovery. Understanding what happens in the emergency room, from rapid assessment to specialized care, can help reduce anxiety and uncertainty during such a stressful event. Being informed empowers individuals and their loved ones to act decisively, ensuring the best possible care is received without delay. Ultimately, knowledge and swift action are key factors in overcoming the challenges posed by a stroke.